Hello, I'm Dr. Dave Armstrong. I'm a low vision optometrist in Virginia. I want to thank you for coming to my second Facebook Live event where I'm going to help people with impaired vision get a better understanding of some of the things that are available to help them see better and therefore function better. Today we're going to talk about bioptic telescopic glasses. That's probably something that you have heard the term, maybe you have some idea what it's all about. I'm going to try to give you an idea of how they work, how they can help, and some of the various types of them that a low vision optometrist might prescribe depending on the individual's needs. So I'll start by saying that if you have ever looked through a pair of binoculars, you know what they do. They make things look bigger and closer to you and therefore easier to see. That's exactly the way that bioptic telescopic glasses work. You can almost think of them as being binoculars with your prescription in them. So let's look at this pair. This is one example of bioptic telescopic glasses. You can see the little telescopes mounted near the top of the what we call the carrier lens, and these are permanently mounted there. They're actually drilled. I think you can see they're drilled right through the lenses, and they're positioned so that they align with the individual's eyes. This happens to be my pair of bioptic telescopic glasses. Now, I'm fortunate to have normal vision, but I have these because I want to have the experience that my patients have when they wear bioptic glasses. That gives me the opportunity to understand better what they're experiencing. It gives me the opportunity to do a better job of answering their questions and explaining what they can expect. So my prescription is in the carrier lenses, and it is also in the telescopic part of the glasses, the little telescope here at the top. And I've used my bioptic glasses for watching television, watching live theater, watching my grandchildren play sports, riding my bike on the greenway, driving my car, and other things. And I've done that enough with them that I have a good idea of how they work, so I can do a good job of explaining them to patients. So that's our first example of bioptic telescopic glasses, and I just want to show you another pair that's similar except for a different looking frame. And I'll tell you that these telescopes and my telescopic glasses are both 2.2 magnifications. So when I look through the telescopic part of the glasses, whatever I'm looking at is 2.2 times bigger than if I were looking below the telescope through the carrier lens. And what that means is that whatever I'm looking at looks like it's only about half as far away as it really is, or you could think about it as looking twice as big as it really is. So that's the way bioptic telescopic glasses work. They make things look bigger, closer, and consequently easier to see. So people with macular degeneration, Stargardt disease, diabetic retinopathy, albinism, and a long list of other eye conditions whose vision is impaired because of those conditions see better because what they're looking at looks bigger and closer. So those two pair were 2.2 magnifications. Now this pair is 3 magnifications, and you can see the telescope looks a little different. These telescopes are round, and the other ones are more or less rectangular. Point is, these magnify more. If a person, for example, was seeing 2100 on the chart at the doctor's office through the regular eyeglass prescription, and then they looked through bioptic telescopic glasses that had their prescription in, you'd expect them to see at least 20/40, maybe 20/30. It would make a real significant improvement in their vision. I take my patients outdoors and they look at street signs that are perhaps close to 100 yards away, highway signs, they can see the route numbers and that sort of thing. So it makes a big difference. Now, one other 2.2 magnification bioptic that I want to show you is this one. This works somewhat differently. Once again, the individual's prescription is in the carrier lenses here at the bottom, and the telescopes are in front of the carrier lens, and they're actually designed so they can be flipped up out of the way when the person doesn't need to use them. So they're right there. If they want to look at something at a distance, recognize somebody's face a little better, or see the pastor in church, they put this down and they can see better, 2.2 times better. So that's just a variation on the 2.2x telescopic lenses. Now, some people need more magnification than that. And one type of stronger telescopic lens looks like this. This is interesting because this little housing has a mirror here and a mirror here, allowing it to be positioned across the front of the glasses rather than sticking straight out of the glasses. If it wasn't for the mirrors, that would stick out probably 3 or maybe 4 inches, about the length of this, at any rate. So this lens, this telescopic lens, has the objective lens here, and at the other end is the ocular lens. That's where the person's eye would be. So ocular lens here, objective lens here, mirrors in between. And another interesting thing about this type of bioptic glasses is that this one can be focused. You see this little knob right here. We can turn the knob, and by doing that, make it focus from perhaps 1.5 feet from your face to across the street, far away as you want to look. So, and anything in between. So if you're looking at a person's, if you're looking at a person's face who's 10 feet away, you can turn that little knob and focus on them. If you're looking across the fields behind your house, you can turn the knob and focus on the woods or the deer or the cows or whatever happens to be out there. And one thing that I'd like to point out is that when you're driving, you're not going to be constantly turning that little wheel to focus it. You get in the car, you focus the telescope down the road where other cars, people, and so forth will be, and you leave it there. You're not playing with the focus of it as you're driving. And all of these bioptic glasses that I'm showing you are approved for driving in Virginia. The Virginia DMV has a special set of driving requirements. We'll talk about those in another Facebook Live event, but these glasses can be used by people who meet this different set of standards for driving. I have a lot of patients who do that. Now, one more bioptic that I'd like to show you is this one, and the telescope in this works just like the one I just showed you. This one happens to be 3x, and the interesting thing about this is that it's autofocus. So if you look at something, the focus pops right in. It comes right into focus instantly. You look at something at a different distance, instant focus. Sharp, comes in real sharp. So I said this one is 3x. This also goes in other powers up as high as 6x. as does the one before. And it's powered by a battery that you may be on the other end of this wire, and probably in your pocket or perhaps clipped to your belt. Nice type of bioptic. They all work real well, and that's just a different variation on the whole theme. So by understanding these bioptic glasses a little better, I hope that if you have one of these problems that has impaired your vision, when you go to talk to your doctor, you can ask them, are you a candidate for this type of glasses? So often my patients have been told by their doctors, sometimes several doctors, that there's nothing that is going to help them. Well, the doctor is really saying, I can't cure this problem. There's no medicine, there's no surgery that's going to make your macular degeneration or these other things go away. It's not going to get any better. Well, what they're not saying or forgetting is that these bioptic type glasses have been available for decades, and many people benefit from them. That doctor just isn't thinking about them at that point. So ask if you'd be a candidate. If the doctor can provide them for you, wonderful. If not, you find a low vision optometrist who is skilled at prescribing that type of glasses and make an appointment with them. Now, I want to also show you a list of conditions that can be helped by bioptic telescopic glasses and other devices for different purposes like reading or using a computer or that sort of thing. These are the problems that patients I see are dealing with, and they can all be helped by a low vision optometrist. So I hope that you will continue to tune in to my low vision Facebook Live events. You can follow me on my Facebook page. That's facebook.com/Virginia Low Vision Optometrist. And then you'll be notified of the timing of the next event. And I hope you will do that. And I will tell you, the next event is going to be this coming Tuesday, which is August the 8th, and it will be at 12:30 during the lunch hour. And I'm going to be talking about the types of low vision glasses that can help people with these problems read better. And there are a number of different types of them, and once again, that's something you should be aware of so that you can be asking your doctor about them, and I'm going to try to help you understand them better. So I'm looking forward to talking with you next Tuesday at that'll be August the 8th at 12:30, and look forward to helping you understand these things better then. So thanks again for watching, and I'll be looking for you next Tuesday.